Hi, I'm Dr. Jodie Ann Senior, and we're here to help you on your journey to recovery. If you've been diagnosed with heart failure, or you think you might have heart failure and you're here to learn. So, step one is, do I think I have heart failure? And you base that on your symptoms, which we've talked about before. Do these match the possibility of heart failure? And if you think they do, then off to the doctor to find out if he or she also thinks that you might have heart failure. So step two is to get the diagnosis. This would be a constellation of the symptoms that you have and the signs, the things that we can physically see, like swollen ankles, maybe swelling in the hands. In our case, we'd be looking at raised veins in the neck, crackles in the lungs that we can hear with our stethoscopes, and things like that. And then, if you have those two and it's looking like maybe you do have heart failure, the next step is to actually investigate that. And in this case, the pivotal tests will be things like a blood test called a brain natriuretic peptide, which, if elevated, is indicative of heart failure, and an echocardiogram, and this is an ultrasound of the heart. So it's not something that is invasive or painful. It's done with ultrasound and gel over the chest, takes around about 30 minutes or so, and gives us a lot of information about the function of the heart, the pumping ability, the ability of the heart valves to do their jobs, and other structural information. It can tell us if you were born with some problems with your heart that might have led to the heart failure, or acquired some problems that now are presenting an issue with the way that your heart has the capacity to pump blood around the body. So you will be sent off to have these, and if these indicate that you do have heart failure, then of course you need to know what the next steps are. So the next step after you have been diagnosed with heart failure is really for the doctors to consider what the cause is. Part of this will be discussing your family history. Do any members of the family have a history of heart attacks or ischemic heart disease or angina? This is trouble with the blockages of the arteries. Is there a family history of sudden cardiac death at a young age, which might indicate cardiomyopathy or heart muscle weakness? So other indications might be other, family members have had a history of heart failure or cardiomyopathy. So that's worth looking at. Then, basic blood tests will be done. These will include looking at the kidneys and the liver, partly to rule out if there's other organ dysfunction that is contributing to fluid retention, because the kidneys and liver dysfunction can both do that as well. Ruling out anemia as a contributor, looking at iron studies. So low iron can also contribute to heart failure. Looking at thyroid function, so if your thyroid is overactive, it could trigger off arrhythmias, and arrhythmias found on an ECG, which is the 12-lead thing that, where they put the dots on your chest and then have a look at the electricity, takes about 5 minutes, or EKG if you're in the US. Then this can give us an idea of what may be a potential cause of your heart failure is. The thyroid, if it's underactive, can also cause problems with heart failure. So that's another reason it's important to do the blood workup. Then the echocardiogram also can tell us, do you have heart valvular problems? Do you have an infiltrate in the heart? So something like protein deposition, cardiac Sarcoid is one type of infiltrative cardiomyopathy. Amyloid is another. So where there is a deposition of materials that shouldn't be in the heart muscle, causing the heart muscle to dysfunction and not contract well or not contract properly. The heart valves could be leaking, the heart valves could be blocking up and not allowing flow through. These are other potential causes of heart failure. And then of course there's things like cardiac MRI. So, this can further develop an understanding of structural problems in the heart. And finally, something like coronary angiography. An angiogram is an invasive test that is designed to look with dye at the arteries using catheters in a cath lab. So it's done as an inpatient, and this will tell us if you've got blockages in your arteries. Those blockages could be a contributor or a cause of heart failure. And the reason for looking at the causes is also to find possibly reversible ones that if we treat, your heart function might get better. If there's not an obvious cause found, then we might call this idiopathic cardiomyopathy. This term just simply means that we don't know the cause. There are other types of causes. If you've had preceding viral illnesses, certainly there's been a lot of press about COVID-19 and the potential to cause heart problems, which include pericarditis or inflammation around the sac of the heart, and myocarditis, which affects the actual heart muscle itself. There are plenty of other viruses that well predated COVID-19 that are also known to cause cardiomyopathy or heart failure, usually by causing a myocarditis. Again, this is inflammation and infection of the heart muscle. There is some potential for reversibility and recovery of this, but some don't get better. And there's also another one to consider if you're female, and that can be a postpartum cardiomyopathy. This is when a lady has had a pregnancy, and towards the end of that pregnancy, or even up to a few weeks after the delivery, then that lady develops symptoms and signs of heart failure. Sometimes this can be very severe and very frightening, and this needs early intervention and treatment. So, if you've experienced declining health after a delivery of a baby, then don't sit on that. Get urgent assessment for that. There are lots of potential causes, but there are also situations where we've done all the investigations and we can't find out why the heart failure is there. We just know it is. So then it's looking at, what are the next steps from there. So having gotten a diagnosis, investigated the cause, then, reversing any of those potential causes is key. If you've done all of that or there is no, possibly known reversible cause, then it's important to understand what are your next steps. So this will then depend on where you are in the world and what supports are available to you. But your family doctor, your family physician will be a pivotal role and a key resource here. They should be able to guide you in terms of knowing what is available to you in your area. But I would recommend, if it's at all possible, that you get referred to a heart failure specialist. So this would be a cardiologist, someone like myself, who their main specialty is heart failure. Every cardiologist varies in whether they do general cardiology or they subspecialise, but try and find someone who deals in heart failure. If you can't, because there's none available to you, don't fret. Then a cardiologist in your area should be able to help you. They will have a grasp of heart failure and how to manage it, what medications are useful, and they will also be a good guide to other resources as well to help you. If you are in a rural area and you don't even have access to a heart specialist of any kind, often the general physicians in the country areas are brilliant across a wide range of areas, and they will be a fantastic resource to help you also. If you happen to be one of the unfortunate ones that's in an area where you can't access specialists very easily at all, then hopefully you have access to the internet. There are plenty of resources online to help educate you and help guide you in terms of what you might be able to do for yourself. If there's a rehab program in your area, an exercise program for heart conditions, then that's another great resource. The nurses and the physios and coordinators who do those programs are highly knowledgeable and very experienced, and can also be a good resource to help guide you in your journey with heart failure. But there is a lot potentially you can do, and of course I'm trying to do these videos to really help educate you wherever you are, especially if you don't have access to heart specialists as a resource. So I'd really like to be able to support you in this way and help with the education side of things, even though I can't be your doctor. But yeah, I really feel strongly that education is key to getting the best results, to getting great survival, and with great education you can empower yourself so that you can get yourself in the best possible position to deal with this problem and hopefully put it behind you, but failing that, to live an exceptional life with heart failure, as it is entirely possible. So again, please keep watching, subscribe so that you don't miss what's coming next, and if you like this or you have questions, you have feedback, please let me know. I would love to know what ways I can be of assistance to you in your journey with heart failure. And take care out there, and I will see you on the next one, where we will look more detailed at what sort of treatments you can have with heart failure. Bye for now.